Hello, I'm Cassie Adams, and this is my cardiac physical assessment for nurse practitioner program at University of Charleston. Let's get started. Okay, so first, if we are doing a cardiac assessment, our patient would not be wearing a shirt. They may have a gown on, or if it's in a clinic, they may have something else on. But something that we could easily open and visualize the chest area. We would begin by looking for any abnormalities that we can notice within the chest area. If we notice any pulsations that should not be there, make sure everything is symmetrical. First, we're also going to start by checking the carotid arteries. I'm going to have you turn your head this way and check for jugular vein distension, and he does not have any. We're going to check this side. That looks good as well. So, if his jugular veins were distended, we would grab a ruler and we would measure to see how many centimeters that his jugular vein was distended. But since his is not, I'm not going to do that. But if so, we would use a ruler to do so. Next, we are going to note the point of maximal impulse, and we're going to begin by coming to the mid-clavicular line, and we're going to go down to the 4th or 5th intercostal space. Just below the nipple line, and we're going to feel to see if we can feel the PMI, and I can. Next, we're going to go over to the right 2nd intercostal space to feel for the aortic impulse, and I can feel that, and the aortic arch. I'm also going to come back to the 3rd and the 5th, 3rd through the 5th intercostal space to check for systolic impulse, and I can feel that as well. If I could not find the point of maximal impulse, we could percuss the chest and find the outline of the cardiac silhouette so that we could find it better that way. But since I can feel his, we're also not going to do that. Next, I'm going to start by auscultating. We're going to start with his carotid arteries to listen for any bruits. Okay. I do not hear any bruits. It does sound normal. And before auscultating, I should have felt for his pulse, so we'll do that now. So I'm going to feel for your pulse, your carotid pulse. It is a good, strong pulse. No thrills. It is 2+ to be expected. And it is at a regular rhythm. Okay, that's good. Next, we're going to listen to his heart sounds. We're going to start over here on the right side of the sternum to listen for the aortic. We're going to move over to the left side of the sternum and listen for the pulmonic. Okay. We're going to move down to that 3rd or 4th intercostal space to listen to mitral and tricuspid. And we're going to move to the apex of the heart, which is the 5th intercostal space on the mid-clavicular line. That sounds good. Then I'm going to switch to my valve. We're going to go back here to the 3rd to 5th intercostal space and listen for any adventitious sounds or anything abnormal. His heart does sound good. It is a regular rhythm. S1 and S2 are noted. I do not notice any clicks, gallops, or any murmurs. No S3 and S4 are noted at this time. All right, thank you.